We are nearing 50 days of the 2026 state legislative session. Over 1,900 bills have been introduced, and we've officially passed the point where bills can be heard in a committee of their chamber of origin, aka House bills being heard in the House committee and Senate bills being heard in a Senate committee. So as it relates to healthcare, community health centers, what are some of the major themes that have begun to develop? Now, one of the first of those major themes is the Arizona State Legislature attempting to address the eventual H.R. 1 implementation. You may recall last summer we talked a lot about H.R. 1, aka the One Big Beautiful Bill, and how when it came to access Medicaid coverage, it was bringing in eligibility redeterminations, it was bringing in additional work requirements, it was bringing in things like error rates for checking coverage for state agencies and items like that as well. And it is a lot to tackle, and we've already begun to see how our folks at the state legislature are hoping to be able to address it. Another major theme that has developed this year is attempts to address our healthcare workforce shortage. Now, this includes items like licensure compacts, which allow a licensed healthcare professional to use that license and practice in multiple partnering states. It includes the expansion of scopes of multiple positions like medical assistants, and it even includes a push for an increase in funding for graduate medical education programs as well. This year, we've also seen a theme develop around making healthcare more accessible within the state as well. We've seen this in a couple of ways, including expanding access coverage, requiring access to potentially provide lactation care and breastfeeding support, along with providing coverage for continuous diabetes and glucose monitors. We've also seen this develop by eliminating cost sharing for multiple items, like prostate cancer screenings and for breast exams. Now, part of the process in ensuring that good bills pass and that bad bills don't is community input. It is so critical that community health center staff, patients, and advocates are actively involved in letting our state legislature know what bills are or aren't positive for our community. So I really encourage you all to sign up for our advocacy calls to action at aachc.quorum.us, because we have a ton of bills that are coming up here pretty soon that we will need your voice on. As always, stay connected. Email us at advocacy@aachc.org, and until next time.